Heather with HealthPartners Clinical Simulation with my colleagues Krista and Hans. We're going to demonstrate a couple different scenarios to give you some more insights into how to facilitate, how to operate the SimPad, and just some ways that you can creatively implement some different scenarios for your learners. And so to start with the scenario, I'm going to do a pre-brief for Krista and Hans. You can see we have our patient here. This is our home setting. So really it's an old hospital room, but we've made just a few simple changes to make it look like our patient is at home laying on a couch. And so Krista and Hans, when you respond to the call, you'll come into the patient's home and treat the patient like you would in real life. And so with this mannequin, remember he has some pretty realistic features. So he's breathing. He has pulses where you don't pretty much expect to find pulses. Sorry, I'm a little tongue-tied. And you'll be able to take care of him as you normally would. I'm going to be the voice of the patient, so I'm going to kind of be standing off to the side back there. Please talk to the patient like you're talking to him rather than talking to me. And then my colleague Lori will be playing a different role in this scenario, and she'll introduce herself so that you know who she is and what role she's playing. Okay? And so at this point is where if they haven't had an opportunity to really use the mannequin before, that they can listen to heart and lung sounds. You can point out some of the different features and get into some of the more specifics so that they're actually able to use the equipment to the best of their ability. And so do either of you have any questions in terms of how the mannequins?
Oh, the mannequin, yeah. Nope, no questions.
Okay.
Do you have questions?
Nope.
Okay. And so then here is the equipment that you can actually use during this scenario. And so of course you'll bring it in as you're responding to the call. The mannequin can actually be placed on the stretcher, taking precautions of course for both your safety and for the safety of the mannequin. Here you have your oxygen tank, your bag full of all your different medical supplies, and then this is the defibrillator if you should need it or monitor that we'll be using. And so at this point, I would give Hans and Krista the opportunity, if they haven't already before, more chance to actually look through the bag so that they can familiarize themselves with its contents and where to find the specific pieces of equipment before we start this scenario. Same thing with the monitor, the defibrillator. If it's one that they're not used to, I'd give them a chance to look at that as well. Any questions?
Nope.
And then as one last reminder, as you are working with the mannequin, we ask that you please wear gloves. Please keep ink pen away from the mannequin's skin, as well as any paper that has freshly written ink on it. And then also, please do not put any pills or liquids or anything into the mannequin's airway other than a device or a tube. Okay?
Okay.